Thank you, Chairwoman DeGette and Ranking Member Griffith, for holding today's hearing on the growing threat of ransomware. All too often, we see our nation's critical infrastructure being attacked from nefarious actors, exposing our vulnerabilities and ultimately harming our citizens. As a doctor, I am aware of the growing importance of securing patients' personal identifiable information and medical records. This body must take a proactive approach to strengthen all critical infrastructure and ensure that all Americans' medical data is safe from those who choose to do harm. Dr. Damath, let's continue the discussion. In your experience, when a hospital or a healthcare system is the victim of a ransomware attack, how long are their systems down? Is it days? Is it weeks? Has it gone on for months?
Great question. We've seen the entire gamut. And it doesn't necessarily always match with how prepared they were. It depends often on who the adversary is, what they've particularly deployed. But one thing I will say is that we need to study this because looking at the latest headlines, it seems like cyber attacks increasing in sophistication, frequency, and potentially increasing downtimes. I see more trend towards weeks to months than I do days. Insofar as these devastating attacks are more impactful and would result in a longer downtime.
So in this recovery response timeline after a cyber attack, does the healthcare system revert to manual patient care systems? You said something that's somewhat frightening to me. You said you're a generation of doctors who have never used paper charts or have never written a prescription. As one of the 5 physicians on this committee here today talking to you, that's frightening to me. How do we respond?
I think that it's key that we incorporate cybersecurity training and preparation into the next generation of medical education.
Would that include paper?
I do. I do think that physicians should be trained to operate in conditions that do not have technology or to rely on less connected technological backups as a stopgap measure for patient care.
When talking about ways to prevent or mitigate the effects of a cyber attack on healthcare systems, some individuals talk about the cloud or having a system backed up. Are these ultimately foolproof ways to ensure that a hospital system or a healthcare provider does not have to pay the ransom or the ransomware attack, or that patients are less impacted?
I think that this trend towards centralization of medical device management, for example, or electronic health records into the cloud is a trend we're not going to see change. I would defer to the specific security protections offered by such cloud architecture to other members of the panel, as it is not my expertise. But I will say that it's a two-edged sword, if you will. The centralization of these into the cloud mean that a single attack on a cloud provider offering services to many hospitals across the country, if attacked, could impact all of them at once. So that being said, many hospitals are not well equipped to defend their systems as it is. So do you offer increased protections from the cloud more so than you would at individual hospitals, taking the risk that if that particular cloud provider went down, hundreds of hospitals could be hit? This is something we're going to have to figure out, and quite frankly, we do not have the data to make that decision currently.
Dr. Damath, I would be amiss if I did not reach out and thank emergency physicians, emergency nurses, emergency technicians, as we have faced a pandemic and as you continue to face the ransomware attacks that are occurring in the medical community. As someone who previously worked at Johns Hopkins Bayview Emergency Department, I have great respect for the work that you continue in the face of this pandemic, and I think I acknowledge that today and thank you. Madam Chair, I yield my remaining few seconds.
Thank you, Mr. Joyce, and I think that the entire panel and the entire Congress would echo your sentiments, thanking
Thank you, Chair
emergency
DeGette.
room personnel. Thank you.